study that we performed under the background that there were a COVID-19 pandemic that began during the early of 2020. The pandemic was still continuing up until now, and among those many reports that were given during the time, it was reported that the number of pregnancy that were complicated with COVID-19 has an increase of mortality and morbidity. Not only that, we also found that there were many reports reporting that the number of preeclampsia cases are increasing in those COVID-19 that were complicated on those maternal COVID-19 infection. So the study is aimed to study the effect of preeclampsia on those maternal COVID-19 infection and to determine whether there are any factors regarding their demographic data, clinical characteristic, or any complications or any symptoms associated with COVID-19 infection that were affected by the preeclampsia state of the patients. The study was performed in our institution, Dr. Sutomo General Hospital, during the period of March 2020 until December 2021. This is a retrospective study in which we gathered the data from the hospital medical record data. And among those, we found that there were 711 maternal COVID-19 cases that were registered during the period of I have stated before. All of the research was already approved by our ethical committee of our institution, and then all the data was gathered. We perform a data analysis regarding the patient characteristic, the patient's demographic, as well as the patient's clinical characteristic, symptoms, as well as those complications that might be related to the COVID-19 infection. As for the result of our study, we found that there were 711 cases of maternal COVID-19 infection, of which we found that almost 30% were complicated with preeclampsia. So to be exact, 72% was without preeclampsia and 28% was complicated with preeclampsia. We found that there were statistically significant differences between the characteristic of the two groups, of the one with preeclampsia and the one without preeclampsia, or especially among the age group, and then the gestational age, as well as the mode of delivery and several other factors. However, we also found what is interesting is that the number of COVID-19 severe symptoms are increased in the group with preeclampsia. So, not to mention, there were also complications that are related to preeclampsia by itself. The number of morbidity is increasing in those with COVID-19 infection that were complicated with preeclampsia. So from the risk analysis, we also found that the risk of admission into the intensive care unit as well as the use of mechanical ventilation are increasing. The risk of severe COVID-19 infection symptoms are also increased, as well as the critical symptoms is also increased. So as we conclude, we can say that the preeclampsia status in maternal COVID-19 infection will increase the morbidity of the patients, but not the mortality, because we found that from our study that there were no statistically significant differences regarding the maternal mortality of both groups. This whole study was performed in our institution, Dr. Sutomo General Hospital, and there were no funding involved. Thank you.